Hello, everyone. My name is Dalton Stoller, and my project is titled An Analysis of Healthcare Disparities Among Immigrant Communities. Now, if you go back to the middle of the 1800s, chronic diseases such as tuberculosis were a really large problem in the United States. And as a lack of advancement in fields such as microbiology or immunology, and a relatively poor understanding of human anatomy and our own immune system led to a lot of beliefs regarding health and wellness that had existed since ancient Greece being believed by a lot of people in the United States. Consequently, a large portion of the economy of Southern California relied on these people, and particularly on those afflicted with tuberculosis, or as they were known at the time as consumptives. Los Angeles County, in particular, played heavily into this narrative and marketed Los Angeles as a higher class city that was of a relatively homogeneous white population. These advertising campaigns also played into the things that conventional wisdom said would ease the suffering of those afflicted by diseases like tuberculosis. Sparsely populated land, clean air, and an abundance of outdoor work in California's budding citrus industry were all marketed as things that consumptives could take advantage of in order to help with the progression of their disease. These campaigns, unfortunately enough for the higher class at the time, had the unintended consequence of attracting large numbers of men who became known as tramps. These largely poor white men were fleeing the economic depression that was beginning to hit their states in the East Coast and the Midwest. Many would ride the rails into Southern California looking for work in the citrus groves. During the 1880s, the number of these interstate immigrants increased to levels that officials in Southern California decided that they finally had to act. This led to the first waves of restrictive legislation regarding immigration. Those who weren't residents of the state of California who applied for charitable relief or for admission into one of the public run asylums in the state oftentimes were simply provided with train fare back to where they were from. This was especially true for immigrants of Mexican or Filipino descent, and the levels of discrimination only got worse after the proposal of germ theory by Louis Pasteur. The newfound realization that diseases could be communicable led to the personification of Filipinos, and particularly Mexicans, as carriers of tuberculosis who were dirty, more likely to be a drain on public funds, and more likely to have severe cases of the disease. These sorts of cultural stereotypes carry over to the present day, and especially along the southern border of the United States. Mexican immigrants, in particular, are less likely to have quality access to healthcare. And although this admittedly does not entirely arise from their position, things such as certain cultural attitudes and ideas of self reliance, a lack of proper health insurance, and worries about job security and immigration status all play into this disparity. And even though our issues with immigration in the United States are hyper visible, especially at a time like now, so, in conclusion, the cultural attitudes and beliefs that lead to healthcare disparities with regards to immigrant communities, especially in the United States, didn't begin recently. These are attitudes and ideas that have been around for long periods of time, especially with regards to Mexican immigrants and the area along the southern border of the United States with Mexico. Although today these issues aren't personified by people with tuberculosis, disproportionate access to reproductive care and differing qualities of care received are just as pressing problems today as they were 150 years ago.